Welcome to Health Live at Seniors Today. We are here on a bright Saturday evening, and we are delighted to have here with us Dr. Binal Dave for the third time on our Health Live webinar sessions. Welcome to Health Live once again. Dr. Dave, how have you been?
I'm fine, sir. Thank you.
Great. Before we ask you to start your session, I'm going to do a short introduction. Dr. Binal Dave is a senior physiotherapist and a specialist in geriatric care, women's health and rehabilitation, aquatic therapy, and has a fellowship in pelvic floor rehabilitation. She has over 16 years of experience, and as people who are familiar, who have been here for her session in the past, she is exceedingly good. And she's written for us as well in Seniors Today. And we always turn to her whenever we want a refresher on her field of expertise. Today, we've invited her to speak about mobility for seniors. That's an area where we think we've been requested. A lot of requests have come in from our readers for a session on that, which is not really for any specific pains or any specific health condition, but just increasing the mobility of senior citizens. And that's what we requested Dr. Binal Dave to take a session with us today. And here she is. How have you been? It's been a while since you've come here to our sessions. Tell me, is there any scare in a facility like yours? Yours is one of the leading therapy sessions in Mumbai city. Given the COVID scare, the influenza scare, is it like what it was 3 years back, or is it much easier now?
It is for sure the scare and the fear is there, but it's better than it was during the pandemic and immediately after the pandemic. Now we do have more number of patients coming to us, but they are sure about the hygiene and the standards we maintain at the center. So we still do wear masks when we interact or we treat our clients, because it's like one-on-one and too much of closeness is there while treating. So we, as the scare is again that another wave is coming, so we are again masking up and taking the vitals, and we are asking specifically over calls if they have any symptoms, so to rest and complete their medications and then join back again for their sessions. Or if they are coming as a new patient, we call them after they finish their dose of medications. So yes, the fear is still there, and I think it's going to be with us for the remaining life.
It's a tough thing for people like yourself, because
yeah.
You have people coming in and they want to exercise, they want to come in for therapy, but at the same time, there is a scare, and especially in centers such as yours where there's water involved, there is more reason to be worried. But amazing that you all are able to ensure that standards are managed, are maintained on a day-to-day basis. Over to you, Dr. Dave, for your presentation. And those of you who have questions, as always, please put them in the Q&A tab, and I will take it with Dr. Dave later after she finishes. She's going to be showing a presentation for 10-15 minutes, and then after that, we requested her to show you a few exercises. We cannot have a live session here because you all are not on view, but so she would not be able to advise you whether you're doing the right move or not, but she will show you. And what you can do is, as always, these videos are there on the Seniors Today website, and you can have a look at it. It's there on YouTube. You can have a look at it immediately, as well as on Monday, and with our takeaways that we have a qualified medical practitioner who writes the takeaways from these sessions. So you can do that. What you can also do is perhaps go to our archives of the webinars and look up the last two sessions which Dr. Dave has taken with us. You can also do that even as you wait for the new video to come in with the takeaways on Monday. Over to you, Dr. Dave, for the session, and then we'll come back. Please keep putting your questions in the Q&A tab, and we will take them after her session is over. Over to you.
Thank you so much. Is my screen visible, sir?
Yeah, it is visible. Thanks.
Good evening, viewers. So today's topic, as Mr. Pradyuman mentioned, it is mobility for seniors. So I'm Dr. Binal Dave, practicing at Aquacentric Therapy. We have a center in Prabhadevi, Worli, and we are an aquatic therapy-based setup where we do conventional physiotherapy and aquatic physiotherapy. So I will skip the introduction because that's already been done. So what do we mean by mobility for seniors? Mobility means you can work for the stretching of your muscles, strengthening for your muscles, building up your endurance for day-to-day living activities, your cardiovascular endurance, your fall prevention, balance. Maybe you are working out together in a group, inside the house, outside the house, in a garden or in a pool. So, what are your tips? How do we gain energy and feel stronger? Your 6 days or 5 days of workout in a week should be like one day you'll be doing stretching exercises, maybe for 15-20 minutes. One day you'll be doing your strength for 15-20 minutes. One day, a little bit of meditation, pranayam, and yoga, maybe for 30 minutes, which is like 15 minutes of breathing meditation and 15 minutes of yoga asanas. Of course, under supervision of a medical person. One day, you can go for a walk or a stroll with your friends to a garden or to a walking pathway. One day, you can mix up all the exercises like stretching, strengthening, walking, and one day you are just doing your laughter therapy with your friends. So that's how you gain energy and you feel stronger day by day. So let's understand few common myths about exercise for seniors. So exercise isn't safe for me because I could fall and break a hip. So let me tell you, it's a pure myth. There are progression of exercises. A person who will guide you for your exercises will assess you first, tailor make the exercise regime for you based on your strength and ability. Next myth, I have joint pain and arthritis, so I shouldn't exercise. Again, I will tell you, it's a very common myth. Joint pain and arthritis, exercises would be the most beneficial routine for you so that you can do your daily living without any pain. And arthritis is an aging process. So how we have graying of hair, we will have graying of joints too. So exercises will stabilize your joint, make you feel stronger and more energetic. Exercise only benefits the body. So it's a myth. Exercise will work on your mental and physical health both. So as I mentioned, yoga, pranayam, meditation, laughter therapy, all that will benefit your mental health. It's too late for exercise to make a difference in my health. It's never too late. There is no age where you can start exercising. There is always a day one for your exercises. You will start with like 15 minutes of exercise. Maybe after 15 days, you will exercise for 20 days, for 20 minutes, sorry, and then 30 minutes and so on. So as there is a dosage for medications, there's a dosage for exercise regime too. Again, a last myth, exercise at this age can cause heart attack. It's a pure myth. We do certain tests like 6-minute walk test and 3-minute step test. We take your blood pressure, pulse, we take the blood test into consideration, and with those considerations, we start the exercises for you, and it would be always safeguarded. And even if you exercise by yourself, you can always monitor your pulse and oxygen. Thanks to COVID, all of us have a pulse oximeter and a digital blood pressure monitor at home. So in between your exercises, you can monitor your vitals and don't worry about the heart attack. It will save you from getting a heart attack, believe me. What are the physical health benefits of seniors exercise and fitness? It may prevent or delay many of the health problems that will soon come with age. If I mention about osteoarthritis, osteoporosis, fracturing a hip after a fall, so all this can be delayed or prevented because in your exercises, we incorporate balance exercises, stability exercises, we make your muscles stronger, we develop your endurance for both muscles and cardiovascular capacity. So we can prevent or delay many of the health problems which can come with age. It also helps your muscles go stronger so you can keep doing your day-to-day activities without becoming dependent on others. This is the most common clinical or subjective history which I get in my assessments, that I have to hold my caregiver's hand or I have to hold my son or my daughter's hand if I want to go to the market or if I want to step down off my house. So we make you do stability exercises for your lumbar spine, for your pelvis, for your shoulder joint, for your hip, knee, and ankle joint. And we work on your reactive balance and we work on your anticipatory balance. So these are the types of balance strategies which should be incorporated into your exercises. So keep in mind, some physical activity is always better than none at all. Maybe you are just going and walking for 20 minutes. That's absolutely fine. You are just doing some stationary cycle at your home, in your house, under the roof. That is also fun. You are doing pranayam one day or 3 days in a week. That's absolutely okay. But do some physical activity. Yes, and the best form and the safest form of exercise for you, as for the international guidelines, is working out in a pool. Yes, so it's safe because it gets your body weight 1/10. The properties of water have healing and recovery properties. With your strength, with the available range of motion, we make you do exercises in pool. You can just enter a pool like 3 feet or a 3.5 feet pool and walk in the water. And you will see how beneficial it is then compared to the land when you are walking on a garden or a walkway. Exercises in water will release endorphins, which are the happy hormones. You can see the smile on everybody's face in this image. Exercising in water is always fun. Believe me, all of you should try it once and you will never regret it. So let's focus on mental health benefits of seniors exercise and fitness. Again, thanks to the pandemic, every other house, some or the other person is facing with some mood disorders or stress about their health, about their family members' health. So that's why a special mention today is on mental health benefits of exercise. It will improve your mood, it will reduce your stress as well as improve your ability to cope up with stress. It will improve your self-esteem. You will get pride in doing your physical activities with independence without anybody's support. You will feel increased satisfaction. There would be an improvement in your body image. You will see increased feelings of energy into yourself, and you will see the confidence. With the confidence, you do your physical activities. Yes, age is just a number. In this image, you see two seniors going into a deep squat, again breaking a myth that it's too late for me to exercise. I cannot do this exercise. I will get heart attack or I will get joint pains. I have arthritis. I cannot do squatting. Of course, a medical clearance and a proper regime you have to follow to achieve this deep squat. This is just an example. So with your impairments, with your difficulties, we developed a rehabilitation program for you to get back your recovery of function, to prevent your impairment, to improve your daily living, your quality of life. So exercise is to be done on daily basis to see the progression and to see the progress in the movements. And movement is a science, so you need a movement therapist or a physiotherapist to guide you for the same. So exercise and fitness. So what are the tips for getting started? First of all, you need to get a medical clearance from your physician or your diabetologist or your cardiovascular physician or a neurophysician. Consider your health concerns and exercise accordingly. Always start slow, recognize your problems, go to a rehabilitation expert, and they will make you exercise. You can call a physiotherapist home, you can call a rehab professional home, and that's how they will make you independent. And then slowly you can work for your mobility at home. Yes, that's a pretty image with everybody holding a dumbbell in their hand. Yes, everybody can hold a weight. You can exercise for your upper body strength. You can exercise for your lower body strength. There are body weight exercises. There are TheraBand, TheraTubes, different resistance equipments available, which should be incorporated in your weekly routine. Twice in a week, every senior should work on the strength, because strength and weight bearing will improve the calcium deposition in your bones, along with the supplements which you would be taking, like your calcium supplements, vitamin D supplements. So strength training is equally important in comparison to other exercises which are available. Aerobics, why not? You can dance with your friends, you can dance with your colleagues, ex-colleagues, you can dance with your family members, you can sit on the chair and dance, you can hold a ball in your hand and dance, you can hold a water bottle in your hand, a Bisleri bottle in your hand and dance. Dance is going to produce happy hormones into the body, and it will benefit us both mentally and physically. Today we will have this example. We will dance together. Maybe I won't be able to see you, but you can see me and copy me and see the benefits of dance. It would be really very easy exercise movements, which you can do it in front of a mirror at your home. So my tagline for today, you are never too old to stay fit. And that brings the end to my presentation. Thank you for your patient listening. And I look forward to see you in some exercise class where we will meet and exercise together. Thank you so much.
Thank you very much. Thank you very much, Dr. Dave. Now, over to you. Could we have some exercises and then we can get on to the questions? As always, those of you who have questions, please put them on the Q&A tab and we will take it as soon as Dr. Dave is done. Yeah. All right.
As I mentioned, always the exercises we start with a little warm up, then little movements, and then again the cool down. And movements will be included with your upper body, your neck, shoulder, waistline, and your limbs. So maybe you start with your neck, like neck up and down, neck up. Maybe you do it 4 to 5 times. Neck side by side, side by side. You take your hands over the shoulder, clockwise slowly, 5 in the front, 5 at the back. Take your hands in the front, open and close your hands. Take your hands by the side and make small circles, clockwise and anti-clockwise. You can move your hands up and down for 5 times. You can move your hands front up and down for 5 times. You can open and close your hands for 5 times. It's just simple movements which you need to do it continuously. And you see the difference after 15 and 20 days. You bring your hands on the waist and make little hip circles 5 times clockwise and 5 times anti-clockwise. Now you walk 2 times to your right side, 2 times to your left side. Keep on doing that for maybe 30 seconds. Walk forward 3-4 steps. Walk backward 3-4 steps. Walk front and back. Right, left, right foot forward, left foot forward, right foot backward, left foot backward. Left, right, left foot forward, right foot forward, left, back, right, back. And you can walk on the place. Walk, 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 walk. Slow walk, fast walk. Slow walk, fast walk. You can tap your heel in the front. You can tap your foot at back. Your hands in the front, slowly touch your hand to the knee. Please note those who have balance problems, knee problems, hip problems, you will always do under a supervision. Same hand to the same leg. Opposite hand to the opposite leg. Now, to progress, you take your hands up and you touch. Same hand to the same leg. Opposite hand to the opposite leg. You can rest for a while in between. You can do a few deep breaths. Take a deep breath in through your nose. Breathe out through your mouth. Breathe in through your nose. Breathe out through your mouth. And change your hands to the side of the rib cage and do the same. Breathe in, your hands will come out. Breathe out, your hands will sink in. Shift your hands over the abdomen. Breathe in, your tummy will come out. Breathe out. Take the belly button towards the spine. Again, you can walk forward. You can walk backward. Forward, forward, backward, backward. Forward, forward, backward, backward. Side, 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 side. So now I'm combining upper body along with the lower body. Side, side, front, 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 side, side, back, back, front, front, double, 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 single, single, double, double, single, single, double, double. So many ways you can exercise at home, and now we will do a little cool down. So maybe you repeat whatever you did during the warm up. Look down, look up, look down, look up, rotate sideways, very slowly, rotate sideways. Bigger shoulder circles only if you don't have shoulder pain. Moving the wrist clockwise, anti-clockwise. Making hip circles again. Take your hands up, breathe in. Take your hands down, breathe out. Take your hands sideways, breathe in. Take your hands down, breathe out. Take your hands in, breathe in. Take your hands out, breathe out. So, this is how simple movements can be incorporated for your daily routine. Thank you so much for patiently watching me.
Thank you very, very much. This was amazing. I think, the very fact that you have shown these exercises and people can play them again once they can access this on YouTube. They can do that from Monday onwards, look up the takeaways. So this has been amazing. Now tell me, I have got one question in already, which says that, doctor, should this be preceded with a walk, or should it be just the exercise that you have shown? Can one just start them without taking a walk?
Yeah, it can be done without taking the walk, because I showed a little warm up. Then we did little side stepping, forward stepping. So don't do everything at one go. Maybe one day you are just doing this. One day you are just going for your walks. If you want to do this after the walk, the duration would be less. So it's purely like you can do 30, 35 or 40 minutes of exercise only if you are doing it since 2-3 months. If you are a beginner, just stick to 15 to 20 minutes of exercise and that's it.
Right. So we have got two questions in here. One is from AM, who says, can you please get the exercises video? Yes, of course. As I mentioned, they will be there on seniorstoday.in from Monday afternoon onwards, along with the takeaways. And they will be, of course, there on YouTube right away, so you can go and watch them. Now, there are a few questions that have come in, which may not be exactly for you, but I'll just take them down if you have some exercise related things. One is from Mr. PR Patil. I'm 62. I'm having both pain in both the calf during the morning. What can be the reason? How to overcome? There's another person, Kashmira Shah, who is 70 and who says she gets sleep at 1 and wakes up at 4 a.m.
Correct.
Is there something that she can do? So these are the two.
Sure. So I'll answer Mr. Patil's question first. So, sir, you
Right.
have calf pain. So there are certain investigations which should be done first, like a certain blood test, one or two Doppler tests, and then we can know the reason. And if no diagnosis is there, then it would be muscular pain. Few stretching exercises should be incorporated before you walk and after you finish your walks to reduce your calf pain if you don't have any other medical diagnosis and it's only musculoskeletal, then you can do stretches for your calf pain and you can also use a warm compress to reduce the calf pain.
Right. And the next one is from Kashmira Shah, who's 70. She gets sleep at 1 and wakes up at 4 a.m. Is there anything that she can do?
So, Ms. Shah, I would like to address that. As I mentioned, a little bit of yoga, meditation, pranayam can help you to a certain extent. You can also play good music before you go to sleep. There are special candles which induce sleep. There are special teas which will induce sleep, but these are all alternative healing therapies. And yoga and pranayam are mentioned and evidence says that they help in inducing sleep. So maybe you can try any of the remedy which I gave.
Right. We have a question from Mr. Anand N, who says, my right shoulder pains when I hold my hand on my waist. What is the remedy?
So for that, an assessment is surely required to know which movement is causing pain, which structure is causing pain. Is it the joint? Is it the muscle? Is it the tendon of the muscle or any soft tissue which is causing the pain? Are you diabetic? Are you non-diabetic? All those subjective and objective assessments are required to answer for that.
Right. This is from Mr. Bridge Duggal, who's 79. He says he's having pain in the shoulders and the waist doing yoga and meditation for several years. He's having pain in the shoulders and waist, but he's doing yoga and meditation for several years. I do have pain during winters. What is the best way to reduce pain?
So few mobility exercises are there and few strengthening exercises should be done for your shoulder and elbow muscles. And as you're already doing yoga and pranayam, that means you are focusing on your flexibility, a little bit on strengthening protocol, and you might see the change in the pain.
Right, thank you. We have a question from Jayanti S. She's 61. After the first dose of COVID vaccine, I have pain in my left upper arm between shoulder and elbow. Sometimes more like waking up from sleep, sometimes not very severe. I can lift the hand up, down, but sometimes feel pain while putting a hook at the back.
Correct.
Is there something that she can do in terms of exercise?
So this looks like a little problem after the vaccine. It can be the start of the frozen shoulder, looking at what the history you are giving. But again, assessment is required to give a diagnosis, and then the exercises should be tailor made for you based on how much is the range restriction, when the pain is coming, at what particular range. And that's how we can reduce and help you to gain back your range and strength.
Right. We have another question, which is from AM, who says, I've undergone a leg bone surgery a year ago, wherein rod is inserted inside my bone below the knee, and I'm not getting ankle mobility still.
So, ma'am or sir, have you done physiotherapy for the same? Because, so after the surgery, physiotherapy and rehabilitation is very important to gain back the range. So, you should go to a physiotherapist and get yourself assessed once.
Right. We have two more questions. One is from Dinesh Paliwal, who is asking for a lady at the age of 72. I've been advised TKR as knee cartilage is worn out. I do yoga and pranayam while sitting. Can I continue to do yoga exercise regularly?
So, CKR has been done when is to be known, actually, that is not mentioned. Then I can comment whether you should exercise by yourself or under supervision. If you're doing yoga and pranayam while sitting, that means you're not able to go down on the floor and do your exercises. Or maybe at your age, you should do guided and supervised exercises before you start exercises by yourself.
Right. This is one last question by Rajiv Virmani. For neck cervical spondylitis, is there any exercise that you would recommend?
Yes, sir. So again, a cervical spondylitis, there might be pain during looking forward, taking back, or maybe side or looking up. So which movement is causing pain? What structures are causing pain? That is to be known first. Then exercises which are suitable for your pain can be advised to you.
Right. To all of you who are there, and there are some 65 people who have come here, which is a a really near full house that we have today. As Dr. Binal Dave has said that for a lot of conditions that are there, it is always good that you speak to a doctor first and get a diagnosis of what the problem is, and then perhaps come to someone like Dr. Binal Dave who can advise you in terms of exercises. Perhaps your doctor can advise you what to do next. And uh, Dr. Binal Dave is, of course, available in her center in Prabhadevi in Worli in Mumbai. And of course, also you can reach her at the center via email or phone. And, she will be able to take a teleconsult as well. For those of you who are not in Mumbai and at the same time would like to get the advice that she has given, please do that. And once again, thank you very much, Dr. Binal Dave, for being here and always being there for us and guiding our readers, viewers over here. And to all of you, we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. You can pre-register, as you know, for our health webinars so that you don't miss out on any session that we have, just in case you're not very attentive on our various promotional media. Thank you very much, and we will be back again. Thank you once again, Dr. Binal Dave, and to the
My
team at
pleasure.
Geriatric for having facilitated this. Thank you very much.
Thank you so much. Good evening.
Bye.